We're here today to kick off our Henrietta Lax Symposium at the King Drew High School. This is a huge event that is brought to you by the Urban Health Institute and the Physician Assistant Program, which was recently accredited and accepted our first class of students who actually started and arrived on campus this Monday.
This conference on the cells seeking justice, and in particular honoring Henrietta Lax and her family, is just an example of the mighty and righteous mission at Charles Drew. It is extremely important that we are here, that we've gathered with the community, with members of the family, and with faculty and students to seek justice and to make sure that medicine, as it is practiced across the professions, considers the social and individual ethical issues that are important.
I'm so excited to be a new faculty member as part of the Physician Assistant Program at CDU. This place is a really exciting place where our students are really going to have the opportunity to thrive and develop into amazing healthcare providers, especially starting with this event. I think it is so important and critical for them to understand what these cells are, what they mean for science and research.
Cells Seeking Justice is an amazing event, and this is a great opportunity for our students to start the dialogue and discussions about ethics in medicine. Our new program is going to have a focus of social medicine, and what does that mean to these students? How are they going to experience that?
I think it was important that the event took place here at King Drew High School just to get the students engaged and be exposed to this kind of information like the HeLa cells and who Henrietta Lax was and how significant one person can be when it comes to the medical field.
I'm excited to be here because it's engaging all of the community, it's engaging the students and the faculty, which is one of the reasons why I wanted to come to Charles Drew, to be able to give back to the community, be involved in healthcare, and to educate those around us. Because I too came from an area that was in a healthcare shortage, which is why I want to be a physician assistant.
I've chosen Charles Drew University because of their mission statement. The mission to help community and health disparity. I believe that even in a great country like ourselves, we have plenty of health disparity. I was born in Haiti, which is a third world country, and access to medicine is not very much. So as a kid, I almost died as a result of lack of health care. So this is the reason why I want to become a physician assistant, so other people who are either here in the United States or in other countries where healthcare is not available to them can find people like me who understand their situation and willing to go out there and help them.
This is what we came here for. Be girls, be crowded. Red drop the needle, the whole spot sure. Drop down and crop circle. Spread hip hop around. That is a gift, man. That energy we giving, pull them out of that quicksand. Feeling that, cause we all need healing. Real life healing while it's so appealing.
Welcome everybody to our amazing event we have for you today. Antics is a multimedia hip-hop theater company that uses theater, hip-hop, urban dance, and poetry to uplift the community. And today they're here to kick off this great event. We have some really special members of the Lax family here, David Jr., Kim, Alfred, Trey, Alfred the Third maybe, somewhere, and then we have also Rebecca Skloot. She's the author of the renowned book, The Immortal Life of Henrietta Lax.
Talk a bit just about my own path to writing this book, because I learned about this story when I was an undergraduate, and I think it's really important for students to hear just how unpredictable people's paths can be and how I ended up writing this book. I want students to learn to recognize what I call what moments. So these are moments that just stop you and make you go, wait, what? And for me, Henrietta's story was that. It's just something that makes you stop and ask questions. And the first time I heard it, wait, what do you mean their cells have been alive since the 50s even though the woman she came from died? What? And taking the time to notice when you're curious about something is so important. Every story I've ever written comes from one of those moments.
And without further ado, I wanted to introduce two fearless leaders, Dr. David Carlisle and Principal Brookins. Really quickly, Dr. David Carlisle is the president of Charles R. Drew University of Medicine and Science, and he completed a Robert Wood Johnson Foundation Clinical Scholars Program Fellowship at UCLA School of Medicine. He also served as the director of the Office of Statewide Health Planning and Development with the California Health and Human Services Agency. Also, Principal Brookins is the principal of King Drew Medical Magnet High School. And he was born and raised in Los Angeles. He's a product of LAUSD, and we're very, very fortunate for these two amazing leaders. Thank you, everyone.
And I just want to say a few words about this book. This is one of the most important books ever written about the history of medicine in the United States. When I was a young student of the sciences, in college especially, I heard about something called HeLa cells. And I heard about HeLa cells, and I used to wonder, what are HeLa cells? But everybody was using HeLa cells. We were using them for research, we were using them for teaching. What are HeLa cells? And then finally I found out HeLa is just a contraction for the name Henrietta Lacks. Every day people are still using HeLa cells, and her family never received its due recognition for their mother's contribution to science.
I'd like to welcome everyone here to King Drew Magnet High School. We enjoy having our partners at Charles Drew University next door because we get an opportunity to have wonderful events like this and invite the community to come and see some of the great work that's happening right here in South Los Angeles. I'd like to tell you a little bit about our history here at King Drew. Charles R. Drew University, King Drew Medical Center, also affiliated with UCLA, and the Los Angeles Unified School District's Office of Integration collaborated to develop a plan to build a school that will provide students of the Watts community with hands-on experience and careers in the healthcare professions.
So what exactly are cells? So cells are the basic units. They're the smallest part of our life that can carry on all life processes. So from the very beginning, when of course we were first conceived, you begin with that one cell becomes 2, 2 becomes 4, 4 becomes 8, and eventually becomes a multicellular animal. Now sometimes we have a couple of unique cells that happen in our body. I'm going to start on the right with the cancer cells. So cancer cells go through the same cell cycle, but they don't know when to stop dividing. So instead of going 1 to 2 to 4 and realizing that's all I needed, a cancer cell is going to keep on growing and dividing uncontrollably. And it's that uncontrollableness that makes cancer spread and can make cancer go through the different stages, 1 through 4. And once you reach stage 4, it is spreading to different parts. Those cancers can break off and spread throughout the body.
When I was in medical school, we knew them as HeLa cells, the cells that came from Henrietta Lacks. And the research contributions that came from those cells are tremendous. Lives have been saved. And this is an important opportunity to also make sure that justice is done and that there are ways that her family, that the larger community, and the providers of medical care can also practice social justice.
So I'm just going to start at the beginning. So HeLa cells, which is what we're going to spend a lot of time today talking about. The word is spelled H-E-L-A, and it's an abbreviation for Henrietta Lacks' name. And Henrietta was a poor black tobacco farmer who grew up in Southern Virginia. And in 1951, when she was 30 years old, she had just recently moved to Baltimore, she was diagnosed with cervical cancer. And she went to Johns Hopkins for treatment, and the reason she went there was because it was really the only place she could go for treatment. You know, this was the era of segregation, and a black woman could not be seen at most of the hospitals because they were white only. But before treating her, without telling her, her doctor just cut a little piece of her tumor and put that in a dish. And he sent that down the hall to George Guy, who was the head of tissue culture research at Hopkins. And George Guy, along with scientists all around the world, had been trying to grow human cells outside the body for decades, and it had never worked. And for reasons that were a mystery actually until fairly recently, Henrietta's cells just never died. And George Guy started calling all these other scientists who had been also trying to grow cells, and he'd say, I think I have the first immortal human cell line, which is what they're called. They led to some of the most important advances in science. So the sort of greatest hits of the HeLa research in the beginning were that they were used to help develop the polio vaccine. They went up in the first space missions to see what would happen to human cells in zero gravity. Her cells were the first cells ever cloned. Her genes were the first genes ever mapped. Her cells were used to develop in vitro fertilization, which I bet there are plenty of people in this room who actually are born thanks to in vitro fertilization, or who have kids maybe that used it. The HPV vaccine we have thanks to her cells. Some of her most important cancer medications, like vincristine and tamoxifen. So just the amount of science that came out of these cells was amazing. And it changed everyone's life. There's not a single person in the world who has not benefited from these cells. And she had no idea the cells had ever been grown, neither did her husband or her kids, right? So in the 50s, they took her cells without asking. In the 70s, they did research on her kids, and now 2003 or 4, it's her grandkids' generation. And now all of a sudden, they're like, wait, our family's genome is online, and what does that mean? And their response in this moment to me says everything about the family. They had two initial questions, and the first question was, can you get them to take it offline while we figure out what this means for the family, privacy-wise, like what does this mean for us? And two, how will this help science and the world if we let them do this? So part of what happened in that moment was really this younger generation stepping forward and saying, this stops with us. We now want to be involved in HeLa research.
As Rebecca mentioned, we are the grandkids, great-grandchildren of Henrietta Lacks, and we have a presentation to show you all just how our lives have changed and been impacted by the book that Rebecca wrote, The Immortal Life of Henrietta Lacks. Here's the only picture that the family has of our grandmother, or my grandmother and grandfather. Top left is the home house that they lived in Clover, Virginia. Now, my grandfather, as was mentioned, and grandmother had a 3rd and 4th grade education, but they wanted more, they wanted better for their children. So they left Clover, Virginia, Laxtown, and went to Turner Station in Baltimore, Maryland, where my grandfather became employed at Bethlehem Steel.
But yeah, and this marks a historic moment because, like I said, when they took the cells in 1951, and all the way up until 2013, the Lacks family was the last to know what was happening. But since this day, now we will be one among some of the first people to know what is going on. And that's definitely
And this is another important milestone in the Lacks family because my father received an honorary doctorate in my grandmother's name, so now we can call her Dr. Henrietta Lacks.
Immediately, my interest is a lot about advocacy, and usually when we talk about bioethics and we talk about justice in communities, we often, when we hear about Miss Henrietta's story, it's always about kind of this victim narrative. Where is the justice? Where are the reparations? It's always on colored bodies. But hearing you all present and speaking to the ways in which the law operated in that time and how times have shifted, how do you understand these narratives changing within your family, within the narratives of your family? From a victim, you mentioned from a victim to kind of this empowered language.
Well, I mean, of course, when when we were younger and initially found out about it, we really didn't know too much, or took too much interest in it. But as we got older and started understanding just what happened, you know, you do feel like, what, they took her cells, and you know, but when you grow up and you understand that Dr. Guy didn't take her tissue because she was black, because she was poor, because she came to Johns Hopkins Hospital. He was taking any and everybody's cells that came in there with cancer and giving them away, and like, here, see what you can find out, see what you can do with them. So it is so much more to the story than just the compensation. Reparation, yeah, because some wrong was done there, because as things progressed from her cells, I feel as though the family should have been notified, and someone should have taken the time to sit down with my grandfather and said, no, sir, this is what we mean by this. We're gonna have someone to speak to you in layman's terms so that you can know just what's taking place. But no one did that at the time, unfortunately. So me, myself, I'm not gonna dwell on the negatives. I'm gonna look forward to all the positives that came from it.
Oh, so what you made a question that had about a white woman writing about a story about a black family?
And just even just you all traveling together,
oh, okay.
All of that works.
It was just one of the things that meant to be, like, I guess if we could see how, with two forces come together. Back in the day, it was Dr. Guy and Henrietta Lacks. The white doctor and the black woman came together, and then we had the HeLa cells. And then fast forward to 2000, whenever you and Dale met.
1999.
Yeah, a Caucasian woman, and
the bottom line is, there's only one race, and that's the human race. You know, Rebecca is like, you know, she was like my mother's adopted daughter. And just, you know, the magnitude and how profound the book has been to our family, and just creating opportunities like this, you know, to speak to young and old, you know, white and black. I mean, like I said, there's only one race, the human race. And I just want to say to the young, you know, the younger generation, and also older people, because it's never too late to learn. You know, we don't learn every single day, then we're doing an injustice to ourselves. But to the children, dream big. You know, have goals for yourself, short-term goals, long-term goals, but have goals. Meet those goals. Be determined. Don't let nobody ever tell you you can't. You know, break down those barriers that people try to build up. And with that, I'll pass it back.
Yeah, Rebecca. Just like Rebecca, as you mentioned, she did not give up. She kept a whole year or two trying to get my aunt to talk to her. She would have scheduled meetings to see people in the family, and she might sit and wait, and they may not show up. But
Her
she
dad
was
stood
determined. She did not give up. She was determined to get in with the family and look at us now.
You know, and in some ways now, the one thing that I wish I could put in there were some of our conversations about the fact that I was white. You know, so Deborah had very strong feelings about the fact that I was white. And so she saw me and she was like, okay, you don't really know anything about race, but you can learn that. And I learned about it because I went, the moment that I was interviewing this guy, Victor McCusick, who was the one who did research on Henrietta's kids, I was sitting talking to him about the fact that he didn't get consent from them, and I asked him why he didn't, and he said, I hope you can explain to those people that nothing bad happened here. And the way he said those people, I went, oh, you wouldn't be talking to me if I was black. Like, it just sort of hit me. And, you know, people talk about white privilege all the time, and I did not know that I had that. And then, and I will never forget going back to Deborah and telling her about that. She was like, see, now you get it. I think one of the things to me about the race story that's sort of amazing that people don't really realize is that, you know, these cells from a black woman were used. I mean, the polio vaccine story is incredible to me. The polio vaccine that was really only available to white people for the most part. If people could have known in that moment, in the 50s, you can have this polio vaccine. It was grown, it was tested on this black woman's cells. All of this is made possible by black people. All of your children are dying. You want this thing that came from this black, all of this incredible blackness.
In your wildest dreams, what is the one thing that you hope to see the HeLa cells do in the future?
Cancer, is a devastating disease. And if HeLa cells can cure that, that would be very instrumental, to all humankind, all mankind.
I just wanted to ask, as future practitioners, kind of how your mother was treated and how your your grandmother was treated. How would you, any advice to give us for our future patients of ethical reasons or how we should just treat people?
A lot of times I got from people reading the book that they know we used to work with HeLa cells all the time. But now that I read the book, I never look at them the same way. And just know when you work with a patient or you work with a specimen, that every specimen, every patient has a story behind them. So just keep that in mind, that everybody has a story behind them.
It was in the 70s when the scientists went back to her kids. When I talked to the woman who was a postdoc who went and collected samples from Henrietta's kids, she thought she had told them what she was doing. There are a lot of people who are just terrified to be at a doctor's office, even if they're nodding and smiling and they're terrified. And so when you talk to them, it's like what Kimberly was saying earlier, it's because they're so scared. Remember that you guys have much more education than most people do. If they had taken 2 minutes at the end of informing the kids about what they were doing and just said, okay, so before we take samples from you, tell me what we're doing. Just tell me what you think is happening right now. They would have said, you've got Henrietta or part of her alive somewhere and you're testing us to see if we have cancer. They were very clear about what they thought was happening. No one asked them.